Good afternoon, everyone. We'll get ready to get started here today for our quarterly meeting of the Kentucky Judicial Commission on Mental Health. Glad to see you all here. Those of us are remaining in Kentucky for now for pre-vacation or post-vacation. I'm a little pre-vacation. I hope all of you get to enjoy some time with your families this summer. Of course, welcome to today. We have some exciting materials to share with you. They should be in front of your seat. For those of you who are here in person, we want to welcome the people who are joining us by Zoom as well. We also have some folks here who are representing Attorney General Coleman. I believe that's Dennis Durbin. If you would like, oh, Denise, I'm sorry. Denise, I misread that. Thank you for being here today. And Blake Voigt is here today for Secretary Friedlander. Thank you, Blake, for being here today. We want to encourage you all to feel free to ask any questions and share as we move through the agenda. We have a few updates to go over. The first update is that we are putting the final touches on the Commission's first annual report that will cover the activities from implementation through December of 2023. Shauna will be emailing you that draft report for you to take a look at. I know she sends out a lot of emails to our commission members. That's because we want to keep you engaged and appreciate you taking the time to read those. The annual report does include a short bio for each commission member. And thank you to those of you who have already responded with any corrections to your bio. And we want to make sure that each of you review your bios to make sure it says what you want it to say. We want to ensure that they are as accurate as possible. So please watch for the report and provide your feedback to Shauna. We're also extremely excited. I almost felt like standing up and throwing up my hands. Extremely excited to announce the passage of House Bill 385. That was the Commission's first legislative package. It was signed by the governor on April the 9th, just a few weeks after our last commission meeting. I think we kind of previewed that for the commission at the time. It goes into effect on July the 15th. And House Bill 385 has three parts. It adds an adult friend to KRS 311.631, which allows an individual with little or no known family to have a trusted friend make medical decisions on their behalf. It also amends part of Chapter 504 to allow a defendant where competency to stand trial has been brought forth to be evaluated on an outpatient basis for the first time by a psychologist or psychiatrist. And then if further evaluation is needed, that defendant can be referred to an inpatient facility. Lastly, the bill is named in honor of Seth Stevens, our commission attorney who lost his life last summer. As a part of the legislative response plan, we have scheduled a meeting with Jailer Daly and his colleagues next week to discuss any jail impact that House Bill 385 will have. And we're working with several commission members to do a brief recording that provides an overview of the bill to be released publicly in the coming weeks. I would like to offer a special thanks to Representative Kimberly Moser for sponsoring the bill. And also we are grateful for other commission members, Katie Comstock, Stacy Tapke, and Colleen Slusher and Wes Butler for their work and input. They certainly all went well above and beyond the commission's work to push that first bill forward and continue to assist us in the legislative response plan. I also hear, is she here in person? Oh, there she is. I also hear that congratulations are in order for now Dr. Colleen Slusher, who just recently received her doctorate in social work. Yay. Thank you, Dr. Slusher. Our staff, though, are referring to her affectionately as Dr. K. We do have another commission member who has changed her position. She has been appointed to the Court of Appeals, and that is Judge Lisa Jones. So congratulations. I think Judge Jones is on our Zoom feed here. So congratulations. Are there any other commission members who have some professional announcements to make, or grandchildren, or whatever you want to talk about? Anyone? All right. Well, you all are certainly movers and shakers, and we're glad for Judge Jones and Dr. Slusher's advancements. Thank you very much. As I'm sure you'll hear later during the work group updates, we are already hard at work collecting legislative recommendations for 2025. If you have a recommendation, please send those details over to Maria at the commission, who is tracking those for us. We will be sure that anything that you recommend moves forward to the executive committee for further consideration. Of course, we've talked a lot in the past about town halls.
If we could, and I do apologize.
Oh, right ahead.
You asked, and I was just a little bit late on the announcement, but so I had one here that
Okay.
I have here that Deputy Chief Justice Lambert, you just kind of shot right by that and wasn't going to share it with the group with us, was named a System of Care champion by the 2024 System of Care Academy through the Kentucky Department of Behavioral Health, Developmental and Intellectual Disabilities on June 6th. Obviously, she was recognized especially for her work as it relates to this commission, and each and every one of us are so appreciative of this well-deserved award. And I know that just slipped your mind and you forgot to share that with us.
Like everything else, it slips my mind these days, but I'm gonna
Well,
get you. Thank you. Thank you. And I was very grateful to receive that from such an esteemed group. Thank you all. During our last meeting, we promised to have findings from the town hall available. So in your materials, let's see which one here. Okay. In your materials, you have this lovely printed town hall report. This is the public facing town hall report. This has not been distributed yet, but after today's meeting, it will be made available on the commission's webpage. And I certainly want to thank Secretary Friedlander, Commissioner Marks, and their team for supporting the town halls while they were going on and afterwards. They assisted in the drafting and review of this report, and their staff, in addition to research and statistics department here at AOC, conducted the peer review on the data that was collected. So thank you to those folks, program and data analyst Ian Shepard, and behavioral health liaison for the commission, Jennifer Van Ort Hazard, also played a huge role in the development of this report. And I welcome them to the podium to share these findings with you. And you can certainly tag along in the commission's town hall report as they present.
Thank you, Justice Lambert, and hello, everyone. Good afternoon. As she said, my name is Ian Shepard. Some of you may know me as the guy that everybody thought AOC stole from the Galt House after the Mental Health Symposium. But in reality, I have worked here at AOC for about 8 years, and I serve as the program and data analyst for the Office of Statewide Programs here. Now, I think everyone knows Jennifer, but Jennifer, would you like to introduce yourself?
I am Jennifer Van Ort Hazard. I serve as the behavioral health liaison under the direction of Shauna here at the commission. You see a lot of emails from me, usually with work group summaries or invites, and soon you'll get to see me around the state as we launch into community mapping. So thank you for having us.
Thank you, Jennifer. So we are going to launch into the town hall report. They gave us 45 minutes and we want to respect your time. So I will be handling all of what I call the technical stuff, right? The statistical portion of the report. And then if you have any questions about the process, right? About the practices that are attached to the numbers that we see, Jennifer is going to step in and she's going to handle that stuff. So between the two of us, we figure we've got this thing pretty well on lock. We're going to start by talking about who came to the town halls. There were 9 town hall events across the state, anywhere from 70 to almost 200 people, depending on which town hall event that you went to. So a very impressive turnout at all of these events, honestly, but particularly some we had hundreds of people there willing to talk about their experiences. In total, about 1,000 people, give or take, came to the town halls. It's hard to get a precise number because, of course, there were duplicates at some of them, and we can't tell who the duplicates were, and yada, yada, yada. But overall, you have about 1,000 people, give or take, who came to these events over the course of August through the end of November. So really exciting to get all of that feedback and to get so much insight from the people in our communities and the experiences that they were willing to share with us. Structurally, the town halls took place at locations that were already in use by the Kentucky Bar Association, and boy, do we appreciate them for that. It was so helpful to already have those spaces set up and all of the equipment there, and it made that whole process just really, really seamless. So we really appreciate them for everything that they did in sharing those spaces with us. Audiences had the opportunities to share their story either in person at the event on the microphone, or if they didn't feel comfortable doing that, they were able to complete an electronic survey that was distributed either, there were actually physical surveys at the site, but then they also had electronic ones that were available by QR code. And so folks had the opportunity to respond to these surveys in order to share what their experiences were, or they could have been the experiences of someone that the person knew who had lived experience. And we'll dig into the demographics of that a little bit. But first, I'll talk about what exactly was on these surveys. What kinds of questions did we ask? So we asked folks, of course, what systems people touched, right? Did they go to jail? Did they have an encounter with an emergency responder? Did they go through inpatient treatment? Did they go through outpatient treatment, right? What all did they encounter during their time encountering the system? We also asked folks how they would rate the systems that they encountered, right? They had a scale of 1 to 5, and we'll get more into that scale in a few minutes. What changes that person would recommend in order to improve their rating, right? So if someone said they rated the system a 2, and we wanted to get that up to a 3, what is it that we can do in order to help make that change happen, in order to help make that improvement happen? We also got demographic information so that we would have a good idea of who showed up to the town halls, right? We asked questions about race and gender and age to help kind of make sure that we had that information available so we knew who was coming and who we were missing so that we could better serve those folks in the community. And then at the end of the survey was a free response question where people could just share their story, right? And tell us exactly what their experience was in the system, what happened to them, and what they would like to see. And so we got a lot of really good, passionate responses to those free text fields. We cannot possibly dig into the meat of all of that today. So we're going to focus on the hard numbers, and we're going to tell you, Jennifer's going to spend a lot of her time telling you about the common themes that came out of those stories. And so we're going to get a little bit of everything as we go through the presentation today. So we're going to start by talking about who completed the survey. There were 276 people out of the 1,000 or so who came to all of the town halls. 276 actually responded to the survey that we distributed. That comes out to roughly about 1 in every 4 people who came to the event completed one of these surveys. They kind of break down into 3 main categories. Category number 1, I am a person with lived experience, right? This is someone who encountered the system themselves and was talking about their own story. Category number 2, I know a person with lived experience. Maybe it was a family member, maybe it was a friend, but they had that connection with somebody who had been through this experience without having gone through it themselves. And then category number 3 was, I am a system professional, and I work with a lot of people who have lived experience, right? So we got a lot of folks from the different agencies, some of the agencies represented here at the commission, right? But then also other agencies that we work with who came and shared their thoughts as well. So those are kind of the three main categories of folks who came and responded to the survey. And there was plenty of crossover, as you can see from the chart here, right? There's quite a few people. Funny thing about this work, right, is a lot of us have been through this stuff, right? Many of the system professionals are people with lived experience, right? And that's what drives their passion. And so we had a lot of crossover there. There were a lot of people who had lived experience and who had a family member or a friend who had lived experience as well. So across those three categories that we talked about, there was lots of overlap between people. So lots of different nuanced perspectives in terms of whether I've experienced something or whether I haven't experienced something, and what systems that I've touched as I've gone through that process. So a couple other things about demographics that I want to dig into. From this point forward in the presentation, you're going to see me using the word subject to describe a person who the survey was talking about, right? Sometimes that's the person who filled out the survey. Sometimes it is not the person who filled out the survey. So that's why I'm using subject instead of something like participant or recipient or whatever other term that I could use in that particular situation. The majority of the survey subjects, almost 2 out of every 3, fell into the age range of 25 to 55. That was the most common age range that we had responding over the course of the town halls. The next most common age ranges just got younger and younger, right? You got 18 to 24, and then the people who were under 18. And then, of course, people over the age of 55, that was the smallest group that we had represented over the course of the town halls. Did you have a comment on that?
I just wanted to share the reason we specifically picked these age ranges was in response to what we see in community services. So you've got services that are targeting your emerging youth population at 18 to 24. And then after 24, you start seeing more of those kind of all adult specific programs. And underneath 18, of course, we see our juvenile programs. So we weren't as concerned with how old everyone was, but where they fell along that continuum of care.
Thank you, Jennifer. We also asked folks about the gender split. That was basically even, about 45% men, 44% women. That leftover like 12% of so was predominantly people who work in the system saying that they work with clients of all genders, right? So a lot of course, a lot of the people who actually work inside of the mental health system or inside of the justice system serve all types of clients. And so they express that by choosing other on the answer to that question. When we looked at race, the most common race of survey subjects was white at 71%. Black was the next most common at 8%. We had 11% who just were not comfortable expressing that on the survey, which is both understandable and totally fine, right? It doesn't necessarily give us as great of data to analyze, but we want to respect people's privacy. We want to expect their comfort level before we prioritize our analysis, right? So we wanted to make sure that people had the option not to share that if they didn't want to. Less than 1% of the survey subjects were Hispanic or Latina. So we had a relatively low turnout from that population, particularly compared to their representation in the general population. So we wanted to kind of take a second to show. Here on the left side, we have the general population of Kentucky. We specifically focused on Black and Hispanic for this breakdown to give you an idea of what we're dealing with in terms of our turnout here. Black folks make up about 8% of the general population of the state. And folks who are Hispanic or Latine make up about 4% of the general population of the state. When we look at pretrial arrests, which is kind of the front door into the justice system part of what we're looking at, and for a lot of folks that we talk to, the justice system was their introduction to the rest of these systems, right? So when we look at pretrial arrests, Black folks are actually represented in that population at 16% of all of the arrests, while Hispanic folks are at 4%. When we look at our subjects, then we can see how we compare to the populations that we're actually serving, right? For our Black clients, we did meet the level of the general population, but we didn't meet how many people are encountering the system, right? Black folks are overrepresented in our system. We didn't quite hit that level of representation in terms of the turnout. And then for Hispanic folks, we didn't hit anything, right? General population, representation in the system, none of it. So the reason that we point that out is because that's an opportunity for growth in the future, right? Is having targeted conversations with the folks who, for whatever reason, were not necessarily represented in the data that we gathered from the town halls. So this breaks down system interactions, right? This is what systems people said that they encountered during their lived experience. Everyone was asked about every system. So you can see based on the percentage, out of the 276 people that we asked, roughly how many of those 276 people encountered each of these systems. At the top, we have outpatient services. 83% of the people who we talked to went through outpatient services at some point during their lived experience that they wanted to share. At the very bottom, we have the guardianship process. Only about 1 in every 5 that we talked to encountered the adult guardianship process. So that's a pretty big range in the middle of all these other systems that people encountered, anywhere from only 20% of the time all the way up to almost 80% of the time. Some of the other really common ones were inpatient services. About 2 in every 3 subjects encountered inpatient services during their time. Being in a courtroom or being in jail, detention, or prison, or having an encounter with a first responder were all just above 50%. So basically 1 in every 2 people, a little more than 1 in every 2 people that we talked to had gone through the court process, they had been in jail or in prison or in detention, or they had encountered a police officer or some other kind of first responder during their lived experience. Now, what you won't see in the report that you have in front of you, the physical report, is a breakdown of, based on what systems people touched, what did they rate their experience. That's something that, unfortunately, for the printed report, we're not able to meet the print deadline to get that information in there for you. However, I have that information. It is here today just for you, folks, and I'm excited to be able to share that. But before we dig into that in detail, I want to talk just a little bit about how the system rankings even worked. People were asked to rate their experience on a scale of 1 to 5, 1 being completely unacceptable and 5 being very acceptable. And they could go anywhere inside of that range. When we look at everybody, the whole group together, without breaking them down in any kind of specific way, what we saw was that the median or middle score was 3, which is neutral. And then the mean the mode or the most common score was also 3, which is right in the middle, right? When we see that both the median, the score that's right in the middle, and the mode, the score that happened the most often, are both the same thing, I like to refer to that as the typical score, right? Most of the people who responded said 3, right? It was neutral, it was in the middle. Of course, we had people who were much higher, and we had people who were much lower, but the typical respondent was saying 3, right? Scores were further broken down by demographic factors or system interactions in order to find patterns. Most of these breakdowns did not end up showing anything particularly interesting to talk about. Someone who had outpatient, for example, there wasn't a significant difference in the rankings between someone who did have outpatient versus someone who didn't have outpatient. Same thing for inpatient. Inpatient wasn't making a big impact on the scores. Everything was neutral across the board for most of the categories that we looked at. There were 2 main exceptions to that. Exception number 1 was race. When we looked at the experience of white subjects versus non-white subjects, in general, white subjects had a slightly higher average score of 0.76 points higher. So in general, white subjects were more likely to report a slightly more positive experience than folks of color in terms of their encounter with the system. The other breakdown that made a difference was whether or not somebody experienced jail. That was about a 50-50 split. So this is about as even of a breakdown as we could have possibly gotten for this report. And the median score for people who did go to jail was lower than the median score for people who did not. So in general, people who did not go to jail or prison or detention as part of their experience with the system were rating it more highly than those who did experience jail or detention or prison. Now, I personally don't find that information to be surprising necessarily. I don't know if any of you might agree with that, but it is something that I think is worth thinking about when we're thinking about the folks that we serve. How are they encountering us? How are those encounters defining their expectations and their perception of the services that we're providing them, right? How does this affect their overall experience with the system? Oh, we have a question.
No, sorry. I mean, with the numbers per se, one thing that helps is just doing the I forgot I forgot the term of it, but the scale with the 6 that kind of can help force on either side. So just want to throw that in there. I mean, I know you got a lot to cover, but that kind of forced them on one side.
Yep, I appreciate you. Thank you. All right. So at this point, I am going to hand the remote off to Jennifer. I'm going to stop running my mouth and I'm going to let her tell you about all of the fascinating trends that we saw in terms of the themes that people shared when they told us their stories of the experiences that they had. Jennifer.
Fascinating. I was going to start by saying not a lot of this is probably going to come as a surprise because most of us work in this field or we have loved ones that are living this journey. And so these are things we're encountering and working to address along the way. Additionally, what the town hall did, I think more than anything, was sit us down with citizens of our Commonwealth and have them tell us everything we're working on, everything we've started, everything we're identifying. And now we have some numbers and some priorities to continue that work that's already begun in this commission. Also most important was that they continued to also say, even there with lived experience, to say, please include our voice in this journey, in this experience. The value of the lived experience is so important to understanding what's happening beyond the intended purpose. And so we wanted to continue to recognize that. Beyond that, we're going to look at the gaps in community-based care, both for adults and youth when you are working with individuals that are interacting with the criminal justice system, as well as behavioral health treatment within the detention facilities, sentencing and diversion, and then involuntary commitment of our adults. So starting here with the adult system, I was fortunate to get to sit at the table in front of all these wonderful citizens alongside Commissioner Marks and of course, Secretary Friedlander and various members of your team. We got to meet a whole bunch of wonderful people around the state and listen to what was said about the lived experience when you're interacting with the court systems and trying to meet those needs, trying to meet those requirements along the way. And not to say, though we know there's shortages of services, there's shortages of providers, not to say that there is a gap in the care provided, but the ability to access that in and amongst your requirements for a court system, in and amongst the system, the symptoms you're living with whatever your lived experience might be, that was really what people identified as kind of setting them up for failure or being part of why they were not successful. Primarily, not surprising, folks were in crisis. They needed crisis care. They needed intensive outpatient services so they could address the level of symptom load they were experiencing while trying to navigate the criminal justice system. We also have a number of special populations that really we know in the mental health field that they might need a different level of care or a specific set of skills being taught, and there's just not enough providers or opportunity to access those providers to gain those skills. And so those special populations, folks with spectrum-related diagnoses like autism, folks with communication disabilities, those were places they just couldn't go. And so when you're on a tight timeline, when you need to meet a court requirement, that was hard for them to be able to be successful with. It's also really hard to go to therapy and write in your journal and do your meditation when you're hungry or you're unhoused, or you don't know where your kids are going to go for the rest of the day. And so those daily living needs not being met was a real barrier for folks to be successful, as well as trying to navigate the co-occurring disorders. We try hard, we know that's an evidence-based practice, but the amount of providers and the amount of services that are out there to give that service has just not met the needs of the community. Also, navigating how to work that out. If your judge orders you to mental health treatment or your probation officer orders you to substance use treatment and you want to go to both, it's hard to do when you're under that treatment plan dictated by a court professional. And so there was an ask for more collaboration, more understanding in those venues to help get folks on the same track to create treatment plans that help folks to be successful. If there's requirements from the court, making amendments, individualizing those plans, becoming recovery focused so that that individual is successful. And ultimately, of course, the goal for a lack of recidivism. So likewise with juveniles, the interesting point with this one is also to be keeping in mind that when we talk about a community with a juvenile, the majority of their time is spent in school. So finding ways to navigate the time spent in that environment with the behavioral health needs they might have, or with the court requirements that might be part of that expectation. No wonder, just like a full-time job, it's hard for that population to gain access to care, complete their requirements, while also being in attention and attending to their needs and requirements at school. We also have the unique, what we call crossover cases. Your individuals who not only might have foster or might be in foster care or in maybe some out-of-home placement of any sort, and then somehow get themselves involved in some juvenile justice case. So now they've got criminal requirements on top of navigating whatever their family requirements, and then you've got a family system involved there as well, trying to navigate not only completing juvenile justice requirements as well as whatever the child welfare cases might require. So again, collaboration, helping folks to have the same kind of items on their case plans, having those community workers, having those court workers work together, speak together, and kind of help that individual navigate all of those requirements in order to be successful. And then I did have to applaud the lived experience that said it enough that we don't really know what we're supposed to be doing. Like, we've got this case plan or we've got this bond condition, and I think this makes sense. I think I'm supposed to be doing this, but then I went out and did this. I know a lot of us learned that in the reentry simulation, like you have to make choices. Like there's only so much time in the day. And so really understanding like, what's the priority here? If I can't do this, but I can do something, what of this do I need to do today and what could wait? And helping folks to understand what that looks like, as well as what the consequences are gonna be if you fail at any given point. So they can make those informed decisions on where and how to spend their time and their energies as they have it. And then as we talked about, the rating obviously for going into detention versus not impacts your opinion on the justice system in general. No offense, Erica, I know we're doing great work, but there was definitely a discussion on that crossover. If you haven't thought about an individual that goes into custody, whether it's for 24 hours or 24 months, there is a process with which their real life on the outside navigates into anything necessary in the inside. And the detention facilities have to navigate security. They have to navigate population control. They have to navigate cost, staffing. But also ultimately, there was an argument from the community about the value of helping those individuals maintain their behavioral health medications at the very least, and accessing treatment reentry from then the day they step back out of that detention facility back into those communities. If you've ever dropped care, calling your provider up after being MIA for a little bit, because you don't usually get a whole bunch of phone calls when you go to detention to say, sorry, I'm going to miss my next appointment. It's complicated. And so the folks at the town halls really reiterated that process and how that really creates gaps in how they can become or continue to be successful and meet the requirements set for them by the court, as well as their own recovery goals. And then having that mindset in general of restoration. If we're going to be in jail, if there's going to be time in the jail, thinking about what that time is going to look like, if that is time calculated to be punitive or if that is a safety matter, and then if there's a way to consider that in a restorative process. Can they be in there long enough to engage in a program, or can they be out soon enough to re-engage in a program? And so keeping that in mind, they asked as sentencing in the system in general works through its time. There is also stigma came up really across the board, and we'll talk about that in a minute, but in particular here. So just working through educating individuals within the detention community about the realities of mental health symptom load, possible demonstrations, behaviors that go along with that, ways we can educate them on skill sets to navigate that, that again are more restorative, of course, keeping safety in mind, but thinking about isolation and some of our kind of go-tos and how that can kind of reintroduce trauma that maybe wasn't shared, was not part of what individuals know about this, but being safer than sorry and trying to keep in mind and continuing that education through the detention programs. Of course, then if we would rather not sentence them or we would rather not sentence them to jail. So the goal, and of course, as we saw in the opinions, folks did not want to be in jail. We don't want to be putting people into jail if possible. And so there was a note about, or there was a lot of comments about trying to be successful in diversion. Again, back to a lot of that realization that this was a lot for me to do. Maybe I thought I understood, but I didn't understand. And then I ended up back in jail or ended up revoked because I thought I was doing the right thing and I wasn't. And so asking for better understanding, asking for more explanation, some of that prioritization assistance to help folks understand and clarify where they should be going and what they should be doing in order to be successful. And then increasing the option for restorative options in that. Can we get more treatment-based, skill-based options if we're going to divert? We're super excited about 202H or about the involuntary competency legislation, but a lot of what we heard also was just about involuntary commitment in general. So whether it's related to a competency hearing or if it's related in general to an individual just being in that crisis mode, there was a number of stories shared about those barriers to admission, those wait times, that lack of crisis, the idea, the misunderstanding of what am I going to the hospital for? Where do I go when I get out of the hospital? And how folks kind of found themselves in cycles about just being stuck in that crisis, not knowing how to navigate that system. And they asked, of course, for then, better discharge planning, more transition to community mindsets during those periods of time that they're in the hospital. And there's also a lot of discussion about a lack of continuity in kind of the aftercare access to that throughout our state. That really varied depending on what region you were in, what staffing situations were in different areas, and where you might be held if you're waiting for that sort of thing. And so there was a large ask to try to find ways to standardize that care and improve that access throughout the Commonwealth for anyone, no matter what time of day you fall into crisis, which, as we all know, is typically after hours. So again, stigma was huge. We all are fighting it and we continue to fight it each day. And so just remembering that fight's not over. We're still trying to normalize and respect the journey that folks are on, particularly in this case, if they are living with any sort of behavioral health need. In and of the symptoms related to a lot of those, you find housing becoming a barrier. You find whether it be recovery housing or whether you just find that paying bills for kind of your standard housing options, low income housing, that sort of thing is just, it's hard to find. It's hard to find everywhere across our Commonwealth. They also noted that law enforcement and first responders in general, that 911 call, your 988 call, some of our mobile teams, those are just incredibly powerful experiences for folks in our community. And we don't always think about that because it's kind of a short time period of the whole court and criminal justice continuum. But they really identified the value and the change in trajectory for individuals when those encounters are informed and have information like the crisis intervention training, where they're looking to de-escalate, they're looking to normalize, they're looking to connect to resources, even from that started crisis point on through the system, and then the sharing of that information. Some communities do that different than others, but what we heard from folks and the lived experience at the communities that talked about that had something of a handoff of information that followed folks on their journey, it was easier for them to be successful. Also along the way, peer specialists who normalized their journey, who gave them hope, who showed them it could be done, who helped them fight that stigma were very valuable, as well as case managers who helped figure out how to prioritize all those things that they needed to do. There is this next bullet point I did want to note that was an error in our language choice. Not the growing need for inpatient substance use disorder, but the kind of continued need and the growing recognition of that, again, in connection to criminal justice cases. So continuing to be mindful that the services are there and folks are still needing them, and making sure that that diversion and those options continue to be present is really valuable. And also the note about, there were notes about not making that a trial and error process. There were folks well on in their years who talked about how many times they had to go to jail or how many times they had to be arrested before they came across that one judge or that new judge or that one community that was like, why don't we send you to treatment? And that changed their life. And so just kind of getting that as more of a go-to instead of a backup plan was one of the asks that came out through this process. And then again, public information regarding court processes. I can't hit that enough. That's something a lot of work groups are working on. That's something we hope to do a lot with some of the mapping conversations, is just, you know, we work it, we do it. Well, I do now, but a year ago, I wouldn't have stood here and told you that I necessarily really understood a lot of that. And so that's a lot of the folks that we're working with, and remembering how complicated that can be. And then our specific populations that, again, might need a different system. You might not just need a couple therapy sessions and some medication management to navigate living with autism. You might have to take into consideration that you can't sign your opinions and really participate in a program necessarily if you're under certain levels of guardianship. And so those are things that we need to keep in mind as we're working on diversion, as we're working on sentencing, and as we encounter folks in community that some of the standard practices might literally be nearly impossible for them to be successful at. And keeping that in mind, as well as with communication, and whether it be a device or deaf of hard of hearing or a symptom of their illness. That being said, the smart stat people were able to draw some additional conclusions. I'll let Ian explain all that.
So these are kind of the observations that we were able to pull out of the report, just a broad summary of everything that Jennifer and I have talked about over the course of the presentation. Demographically, we had a population that was a mixed group of men and women, generally ages 25 to 55, who were predominantly white, and they experienced a number of the systems throughout the justice and mental health system, the most common system encountered being outpatient services.
Can I jump in there real quick?
Yep.
Something I meant to say too when we first started was, it should be no surprise and almost reassuring to us that outpatient services, community-based practices were the #1 thing that came up in conversation. At the end of the day, that should be our goal no matter what. So not to say that there is a flaw in connecting to that, but more so to highlight that this is where we want people to be, whether they're court involved or not. And so wanting to not lose the value of how many folks had entered outpatient treatment, of people talking about living with a mental health disorder in the court system, because we often talk about folks that have never seen that treatment and that haven't had that opportunity. So did want to highlight that that was also something of a win.
Excellent observation. Thank you, Jennifer. Of course, when it came to the system ratings, folks largely rated the system as being neutrally acceptable, although there were lower ratings for individuals who were non-white, as well as for individuals who experienced jail, detention, or prison during their time in the system. There was a recommendation to focus outreach to groups who were underrepresented. One suggestion that came out of this conversation was the idea for having virtual town hall options available in the future if another town hall event were to be explored in the future. Reentry was also broached. Roughly half of the subjects experienced jail or prison, yet only a third actually reported receiving reentry services. So we have a larger population of folks who are encountering jail or prison than are actually receiving any kind of reentry process as they come out. System needs that were mentioned included affordable housing, specialized placements, accessible transportation, as well as more experienced and competent staff across all parts of the system. And then finally, some additional recommendations that folks had as part of the surveys included the reduction of stigma, intentionally including voices with lived experience, not just in the form of these town halls, but in conversations about our policies, in legislative conversations, and things of that nature, as well as systemic changes like increased funding for treatment and changes to policies. So with all that, that is the end of our presentation. The contact information for both Jennifer and myself is here and available for you if you would like to reach out to either of us with questions. Again, if you have any data, like number specific questions about the actual substance of the report, feel free to direct those to me. If you have questions about like policy ideas or the themes and the feedback that people gave as part of their stories, I recommend getting that stuff to Jennifer. If you have a data request that this inspired you, oh, I would actually love to see more numbers on XYZ thing, this is the link to our statistics request portal. You can get to that on the KCOJ website by going to the main page, going to the court statistics. There's a little graph on there, you can't miss it. And then you scroll to the bottom of that page and there's a button that says request custom report. And you just click that button and there's a little survey that you fill out that has all of the information that our research and stats department needs to answer your question. Someone will reach out to you and have a conversation with you about why you need the data and when you need it and all that good stuff. And it's a really good process. A lot of support from our research and stats team went into this report. So we appreciate them, and you'll appreciate them if you reach out to them and ask them data questions, because they're a great group of folks who have lots of really sharp knowledge and are really good at these conversations. So we recommend engaging them if you are interested in learning more about any of the topics that we discussed today. Thank you all so much for your time and attention. We appreciate you, and reach out if you have questions. Thank you all.
Thanks, Ian. Thanks, Jennifer. Does anyone have any questions today? You can ask them freely. Any questions?
The only thing in your report that surprised me a little was that lack of housing was not mentioned more frequently than it was. I think most of the people who come to us lack safe and stable housing. Do you think that could be a function of who came to the town halls or something else?
That's what I was going to say as you were posing that question. I think that's a great point about lived experience, because also transportation didn't come up as frequently as I'm hearing it as we prepare for community mapping. And I think that's a function of how to get somewhere and share your answer. And so I think that that's an important thing as we keep in mind how we survey and how we talk with folks and welcome that feedback. So thank you.
Anyone else? What about our Zoom folks? Do you have any questions?
Other Zoom questions?
Okay.
I did want to
Go
ask,
ahead.
and this wasn't part of our presentation, but do we want to talk for just a minute about where we're going with this data or why we did all of this data?
Absolutely.
Because I'll probably never forget the very candor with which Justice Lambert presented herself when asked how she had time to do this work. And so this process, first and foremost, got us out into the community to talk about this room. You know, this is a transparent, across all branches of government initiated commission. We're not in here making secret plans or hijacking processes. And so being able to get out there and explain that intention, explain who we're looking to serve to the state was a very valuable experience. It brought a number of inquiries. We've definitely seen an increase of those through our public email system. And now we've got this data and we've got to use not only as we move forward with funding, with legislation requests, it is also the kickoff then what we're going to take into our community mapping experiences. So this, on top of the statewide mapping, will serve to inform how we approach communities, in what order we approach communities. Wow, we have 120 counties, always going to be beyond me, but we're going to get to all of them somehow, some way. And this is going to help us to figure out, when we look at the sectional data, where to go and how to serve those folks when we get there. And so we kick those off next week with the great Honorable Marcus Vanover's region. He's avoiding eye contact, so I don't make him talk about it. Okay, he's really excited. He just won't tell you. And so that's part of a lot of where we'll use this information.
I have a question for the group based on one of the reflections you consistently made, which is the inclusion of people with lived and living experience. And are there opportunities for us to lean into that heavier in the way that we operate on a regular basis, not just the listening sessions, but in day-to-day operations? I'd be interested in us thinking through what that looks like. So question, comment. Has anyone else thought about that? Do we know what representation of lived experience looks like in our work groups now? Is it sufficient? Do we need to push for more representation? Interested in it all.
And I would extend that question to how, because I know we've done a lot of invites. That's one of the things the town hall brought up, was the opportunity to invite folks to join. And I think face-to-face, that encounter was really exciting. People bought in. But then the idea of work groups, the idea of joining them, we've really seen that kind of trickle back off, and getting folks to engage as we're going into the communities has also proved a challenge. And so we're definitely open to feedback and suggestion that folks have heard on how to make this a welcoming experience and how to extend that invite more effectively.
One of the things we're doing in core world is using a community advisory board of people with lived and living experience as a specific structured organization that feeds input into our larger state implementation team. I'd be also curious of exploring ways in which we're not just convening individuals with lived experience, but being convened by them on their terms.
Go ahead.
We do intentionally do outreach to ensure that at least one individual with lived experiences on every work group. And we did target, the town halls did give us an opportunity to target those champions that stood up and that we could identify quickly. And we got those added. In addition to what Jennifer talked about and the community mapping that, of course, we are so grateful that Judge Vanover is taking on for us. And it, just to reiterate the importance of this, we are the first state in the nation to approach community mapping across all three settings, or all three systems in one setting, and how that they all cross over at some point. And, you know, with the criminal justice system, we intentionally look at how can we deflect and divert from the criminal justice system, but child welfare and juvenile justice, there was opportunities to identify and offer prevention services way beyond someone ever coming into. So hopefully this is going to give not only us a lot of data to move forward, but also to be used as a model for other states to implement. Also the town halls, anything that come up in the town halls, we push those to the work group. So for example, one of the very first concerns that was brought forward was someone that was had been under guardianship. There was issues with restoration of rights, being able to read the order, her not being able to get her driver's license back. We immediately pushed that to the guardianship work group to look at how that we can overcome those barriers. So in addition to the community mapping happening, us sending those individualized or identified problems to the work groups, Debbie Hall and her team with specialty courts took these preliminary, these preliminary findings back, and they drafted an agenda for this recovery oriented system of care summits that will be the first, our first opportunity to train on these. And I didn't know if one of you guys wanted to speak about Ross real quick, since you have a microphone.
I'm just so excited to plug it. Thank you, Shauna. Our Ross summits will happen. We will have one summit in each appellate circuit starting June 26th in Northern Kentucky. It will be held at Northern Kentucky University. We are very fortunate that each area's justice is going to do our opening remarks. We have lots of content throughout the day. We will have presentations based geared towards person-centered language and person-centered approaches, content around TBI, traumatic brain injury, and acquired brain injury, and how to interact and approach those folks, and proper responses for folks who may be struggling with that. We also have a session on harm reduction and the justice involved. So we can really talk about how those things really can collaborate and work well together. And then we also have a panel discussion at the end of the day. Oh, I forgot the best for last. We also have our community mapping session that Shauna and Jennifer will highlight the community mapping efforts that will happen. And then we will have, at the end of the day, we will have our panel discussion that will include from each region's area resources in that community that have worked together to target and accomplish what they feel is a recovery-oriented system of care, and they will share their experiences of what worked well, what didn't, and there will be folks with lived experience on that panel as well. Volunteers of America are partnering with us to host those panels. The sessions are free, thanks to BJA grant funding, and we will also have lunch for everyone. There are CLEs offered at 3 of the locations, which are Northern Kentucky, Louisville, and Paducah. And then CJEs and CPEs are offered at all of the sessions. And then Brenda has offered to get social work credits for us as well. So more information to come on that. So some of our locations have already filled up. We have up to 200 people at each event, so we're really excited and we're really thrilled. We hope that you can join us, and we hope that if you have gotten our information that you will share it and invite any of your contacts to join us as well. Say it again.
No.
We are not taking exhibitors at the facility, but we are collecting resource information. So if any of your agencies or your collaborating partners have resource material that you think that the audience members would benefit from, you can see me afterwards and I can get you the contact information so we can take that material and have it dispersed to the attendees at one of the summits or all of them.
Thank you, Audrey. So that's 3, right there, there's 3 examples of what these town halls have fed. The work groups, the committees, of course, the Ross summits, and then a community mapping. Just really quickly, because I know we threw the term community mapping at you and probably did not explain that well. So I just want to, everybody remembers we did sequential intercept model mapping, was our very first activity as a commission that looked at the criminal justice system. We came together, mapped out all the intercepts or touch points where that we could divert and deflect individuals from the criminal justice system. And so we called that SIM. You guys received a report on recommendations on how we can move those initiatives forward. We also duplicated that process with upstream, which is essentially doing system mapping for child welfare. And we also did that for juvenile justice. So we mapped through this sequential intercept model all 3 systems. And because we can't when we pulled them all 3 together, we could not come up with a term of sequential intercept mapping, upstream, juvenile justice, all that together. So we are just referring to it as community mapping, but it will essentially identify touch points across child welfare, juvenile justice, and the criminal justice system, and come up with real solutions for those community partners and court partners to implement true change in their community. So here you go.
I like the new community mapping term. That sounds so much more approachable and manageable. Thank you for that. And thank you all for putting together all this good data from the town halls. We do plan to have these again at some point. No decision's been made yet whether it will be done annually or semi-annually or whatever, but we will be getting all that information to you, and smaller groups of us are meeting throughout the state in upcoming weeks with various communities. Okay. Next is our committee and work group updates, and their quarterly reports are in your three-hole punched materials. So you can take a look at those if you want to, as the presenters present. And we'll start with Judge John Tackett with the Criminal Justice Committee update.
Thank you. Start, Brandon. I'll use this one. Thank you. Thank you, Justice. Let me just take this time really quickly. I'm really thrilled to be part of this commission for several reasons. But one is, it's one thing to be well-intentioned and well-meaning, but we need to do more than that. And I feel like this commission gives us that opportunity to really learn this stuff the right way, to coordinate with each other, to use this collaboration to, really put into some possible systematic changes to get the right results. So I feel, incredibly blessed to be part of it because I'm learning. I'm, trained as a judge. I've been doing the mental health court for almost 6 years. But, having this, group together provokes conversations in my own communities. We've talked to Judge Mayer and her deflection group. We've had conversations, and just through those conversations, I think that we're improving community to community. So I'm just very thankful for all the hard work that Shauna's doing, Jennifer Van Ort Hazard, Ian, and I'm just exceptionally honored to be a part of it. And I think we're doing great stuff. And we have some wonderful hardworking work groups that have put a lot of hard work and effort into their plans. Of course, I'll get to them in a moment, but I just wanted to mention that. As far as the Criminal Justice Committee is with my notes here, we did have a presentation on the Find Help Now program, which is a an internet clearinghouse that provides information for folks who are out there looking, whether it be recovery or housing or mental health resources, substance use treatment resources, and naloxone sources. And it's a really wonderful avenue, wonderful program for Kentucky. I know that they're continuing to build upon it, develop additional resources. So all that's coming soon. Also, I know that our work groups have begun exploring legislative recommendations as well, and we'll continue that. Of course, Dr. K down here, she was helpful with the 202A legislation that has passed, so she can, another feather in her cap. She'll always be Director Slusher to me, though. So, but Dr. K, I'll let you start with the competency group.
Thank you, Judge. Okay, so some of our action items for our competency work group have already been mentioned, but I'll reiterate them. We're thinking about next steps to make sure everyone understands House Bill 385, SES law, and how these changes affect them and their role, whether that's a judge or someone from DPA or an advocacy group. So we are scheduled to create a video next week, and we're excited about that so that everyone feels very well informed about their role in this process. As Judge Tackett just mentioned, some learning opportunities. I think we're all learning in the competency work group. Sometimes we know what isn't working well for our system, but we're not sure what the solution is. So we have some really bright minds in that work group who have helped us think through some real solutions for barriers that are plaguing the system for people who are going through competency. So I'm very grateful for all of their hard work, and they remain very interested in next steps for this really unique population. We have had some technical assistance through Council of State Governments, who's been really helpful in thinking through how AOT can play a part of the solution for this competency population, and that's been really helpful. We're also turning to them to help us think through how to measure some successful outcomes as we get into House Bill 385. So KCPC's been able to demonstrate how that's improved the felony system in a lot of ways. But as we move through statewide implementation misdemeanor cases, that's going to be even more important, especially if there's more legislative changes to come down the road. And let's see what else. We are continuing conversations around a uniform approach for rescinding orders. That's become somewhat complicated just in hearing different people's opinions on that. And Judge Phillips has helped us think through how she's implemented that in the past. So that's still in process. We're finalizing the form for our firearms prohibition. I think we're in the last steps of that as well. And we are also thinking through legislative recommendations through the survey that Maria sent out. I always like to give an update on some of the other changes that we're doing. One is the program in Jefferson County Jail, Louisville Metro Department of Corrections, and our competency restoration program there. Yes Care is the medical provider in that facility, and they established an actual dorm about a month ago, and we have completed restoration for 13 patients so far, I believe. Don't hold me to that number. And our competency restoration is about 70%, which falls in line with what research tells us to expect. So we are feeling that that's successful so far and looking to replicate down the road, as you'll hear me talk a lot about. And that's, I think, it, unless someone has questions for me about competency.
I think the next step on the form is for the judges to receive that.
Okay.
So if you are a commission appointed judge, look for an email to review that form, please.
Pete, that the good news story for the competency restoration, where was that?
So that's the program that we've piloted in the Louisville Metro Department of Corrections. So it's for people that we select to be good candidates for jail-based programming.
I couldn't hear where it was.
Okay,
I
yes,
got it.
Louisville.
Thank you.
Yep. Anything else? Okay. Thank you.
Were there any questions for Dr. Slusher by Zoom? Just curiosity. Guess not. Okay. Thank you, Dr. Slusher. I appreciate all your all's hard work with the competency work group. Now I'm going to turn it over to the Honorable Court of Appeals Judge, Judge Lisa Jones, to provide us an update on the juvenile justice work group.
Thank you. So we've had one meeting since our last quarterly meeting. Our next meeting is going to be this Monday, so we just missed it, June 24th. But we've been working on reviewing the juvenile justice mapping that we did with the National Center for State Courts, and they have combined that with the upstream mapping, and we reviewed the overlaps and still the gaps with that and the opportunities that we need to increase, especially the pro-social efforts, training for community-based providers, and crisis stabilization units for our youth. Those were some of the three areas that we found the largest gaps in need for services and opportunities for improvement in. We also reviewed the findings from the statewide vaping survey with court designated workers and county attorneys. We've viewed that as an entry point into the system. And if we could find consistent ways that communities who were not funneling those cases into the juvenile court system could, if we could expand those intervention programs to those areas that were funneling them into court, then maybe we could divert kids out of the juvenile justice system, was our hope. We need to, we also reviewed the bills that were passed during the 2024 session and how they impacted juvenile justice, because there was a lot of work going on that did have an impact upon the juvenile justice system. And we need to continue to look at that and to apply that to our 2025 legislative recommendations. We're also hoping to piggyback off of the work that revised 202A and look at how that will affect the legislative recommendations that we've had in the past about impacting juvenile involuntary hospitalization. So we want to try and mirror the language as much as possible so that it's consistent and there's a smooth flow there. So our action items right now are identifying the opportunities for statewide pro-social efforts, to continue to explore training for community-based providers, again, to explore increasing crisis stabilization units or crisis stabilization services for our youth, and making those legislative recommendations. We've also discussed breaking up the work group into possibly smaller groups, because right now the one juvenile justice work group covers all points in the SIM mapping system. And so that makes a lot of discussion over a lot of wide areas. So we might be able to target and accomplish more if we break down into smaller work groups. And at our next meeting, we look forward to adding Randy White, our new DJJ commissioner, to the work group and hearing from him. And that is our report. Any questions?
I don't think so, Judge Jones. Thank you so much for your report.
Thank you.
Unfortunately, I don't believe Joe Ross or Jim Daly could be with us today. But I will just let you know that their report is within your packet. I was lucky enough, I try to make it to as many subgroup meetings as I can, as my dockets allow me to do. And I did attend the last one. We had a wonderful presentation from Chief Jeremy Thompson and his victim service specialist. And what they're doing is adding a social worker as part of their police force to go out and to interact with folks. And we're talking about that too. So the idea is to develop a police social worker subgroup from this group as well. We're also going to, I think, dive into mapping jail types and services throughout a statewide jail survey. And then this subgroup will also be working on their own legislative recommendations for 2025. So that's just a really quick and nerdy summation of their work group report, but it's in your material if you want to look at that. So now I'm going to turn it over to Erica Hargis with reentry.
And just before Erica does her presentation, I wanted to take a moment to point out this very impressive piece of printed work here from the Juvenile Justice Group that's laying on your table. So you can take a look at that later. Thank you, Erica.
Thank you. So the reentry group has began our meetings. We started in March, so we've now held 3 meetings. At the beginning of each, we've been adding some members and doing some getting to know you stuff. So we're still kind of starting out. We have heard from a lot of guest speakers. Our vision at first was to make sure everybody was at the same educational level as far as what reentry is and what it kind of looks like. So we've been spending the last few meetings having guest speakers and really just understanding what that looks like. So we've heard from Dr. Russ Williams, who is over mental health for the Department of Corrections for the prisons. Then we've heard from some people that are doing reentry services out of jail facilities. We heard from Brittany Harrington with First Day Forward. And I wanted to shout out what Dr. Marks said about people with lived experience. Brittany is on our committee and very active and shares her lived experience with us through that. So we're very thankful for her perspective. We also have a lot of other members on that committee. I think our committee probably has a lot of lived experience on there, which is wonderful and needed. We also heard from our Division of Reentry Services for the Department of Corrections and kind of how that's going. So a new initiative that we learned about was our new reentry checklist that the Department of Corrections is doing. And so the members were able to hear about that and kind of hear about how some things are going to be passed through with that client and follow the client as they are leaving incarceration and coming into supervision or going back out to whatever they're going back out to. And so we talked about that with the members, and our upcoming meeting, we're going to go over our legislative ideas. I haven't seen them yet. I'm excited to hear what our survey results have and just see how we can kind of fit in this space and help. So that's what we've been doing.
Any questions? Thank you, Erica. That is the Criminal Justice Committee and all our subgroup reports, Justice.
Thank you. As I drop everything, sorry about that. Next, we will hear from Judge Foster Cutoff of the 3rd Judicial District of the Civil and Family Justice Committee.
Thank you, Justice Lambert. First and foremost, I would like to thank Jennifer and Maria and Shauna for keeping our committee in order and keeping me straight and trying to make us look as good as possible. I tell them that's their job, is to help us do our best, and they do that very, very well. Our Civil and Family Justice Committee met on May 15th. I'm just going to give you a brief summary of what we talked about before introducing our work group people. Our committee heard a great report from DCBS about programming that focused on high acuity youth. 2 people presented, and they gave us some very good information about non-traditional placement trends, noting that certain counties that are experiencing outlier data. That was pretty eye-opening. Connected to crossover with criminal justice involvement, trauma, and mental health, or IDD. We got an update on DCBS response to collaborate with primary care providers to improve crisis care options, bi-monthly meetings with stakeholders, and continued our collaborations with partners at AOC, DJJ, DMS, and DBH DID. And they talked about new MOUs to build bed capacity, improve sustainability of per diem rates, and provide our new trainer opportunity for caregivers. So overall, it was a very, very nice presentation, and we were very appreciative that they were willing to come speak to us. Our work groups are hard at work, and they meet quite frequently. And like Judge Tackett said, my dockets usually keep me from attending those work group meetings, but we try when we can. They are exploring legislative recommendations as well as continued work plan development and action items. Our work groups consist of guardianship and commitment, and those started as one group, but it's 2 different work groups now, but they're both led by Stacy Tapke. The domestic violence work group led by the Honorable Denise Brown of the Jefferson Family Court. And I think who I've got here in person today is the Honorable Marcus Vanover from the Pulaski Family Court. He is our dependency, neglect, and abuse work group leader, and Judge Vanover will let you talk.
Here we go. So our dependency, neglect, and abuse work group met on May 8th and June 7th, I think, since the last time we had a commission meeting. As we've said before, we've been working on 4 priority areas. The first one has been enhancing collaboration. A few years ago, the cabinet and the courts through the Judicial Engagement Work Group had been doing I can't remember the name of the term, had been doing a series of trainings at work to enhance their understanding of what each other does. The judges and the cabinet did these trainings together to try to better understand the processes from both ends. This time they're revisiting those trainings, and relationships matters is what they were called, now that I thought of it. They're trying to expand the roles of who they're going to reach for these trainings. Last week, the Judicial Engagement Work Group met here in this room, and the subgroup with our dependency, neglect, and abuse work group were able to take some ideas from that and come up with a couple of training matters that they're going to be using for the next series of relationship matters trainings as part of this priority area that we're working on. We've also been working on understanding roles of treatment providers, and as part of that, that team has been developing a bench card that the judges will be able to use to understand what different types of providers are able to do, what their licensing requirements are, and any limitations that go along with the recommendations that they can make. Additionally, we've been talking about different types of assessments that the courts typically order, kind of outlining what those assessments are and specific terminology so that everybody is kind of using the same terms and making sure that we're requesting the right types of assessments to be done, which hopefully will save a lot of confusion. Those bench cards are very close to being able to be published, and we're hoping to be able to have those ready and start giving out to the judges for the fall Judicial College for district and for circuit judges. In addition, we're working on ways to distribute that bench card to other interested parties that may need it, make sure that that we get them out to our social workers, that we get them out to our treatment providers who, so they know that we're all on the same page, and getting them out to other system partners. Additionally, we've been working on coming up with some resource guidelines. The initial draft of that has been done for some time, and it's so detailed that we've been going through it and working on the revisions of that. I think our resource guidelines is getting very close to being finalized as well. Since we were getting close to finalizing a couple of our priority areas, we've tried to step up and take another priority area on. We are working on revising training for court-appointed counsel and guardian ad litem in our dependency, abuse, and neglect cases. For years, it has been required that our court-appointed counsel have an initial training in order to be eligible to be appointed for children and families in our dependency, neglect, and abuse cases. Sometime in 2019, there was a committee put together to revise and update that training, and they put a lot of work into that. I think Justice Lambert and Judge Thompson were keenly involved in that. I remember one session that they were working on together that was really good. And everybody was getting ready to deliver those when everything got shut down for COVID, and so everything had to move online. And now that things are opening back up, we're taking another look at those trainings and trying to revise and update any changes in the law for those things, but trying to take a broader approach to what is being discussed and look more into some mental health aspects of that, into child development, behavioral health issues, and substance misuse information, so that our court-appointed counsel and guardians ad litem are understanding more of the mental health and substance misuse aspects of that, so they can better relate to their clients and the children that they're serving. And I think that is there's some really good ideas coming out of those sessions for how we can make this training better and more relevant. As you've heard discussion, we've also been working on the upstream portion of this for the system mapping for the child welfare system for dependency, neglect, and abuse cases. That's been upstream. The statewide report came back. I think you received that last time, and now it's time to start putting it into practice in our local communities. As you've heard, we are going to be doing the system mapping for Pulaski and Rockcastle counties. I want to applaud the other judges within the 28th District and Circuit. Whenever we realized that it was going to be 3 days and we were having trouble finding the time for other jurisdictions to be able to make 3 days work, I went to all of the judges in our circuit and district, and every one of them was agreeable to step up and say, we'll co-host and help out with this. And everybody has really bought in to the process of system mapping and taking a look at, as Shauna said earlier, we're the first state to try to do this wholesale in regard to all three programs with criminal justice, juvenile justice, and child welfare. And we're hoping that we provide a good example of something that will work across Kentucky and beyond. So we're really excited about our community mapping opportunity. And the next thing that our work group will be looking at is, once we get the recommendations from the individual jurisdictions, seeing how we can better propose for other places about who they need to bring to the table, about action planning and what we can recommend for improving the process. I'm sure there'll be a lot of gaps in learning experiences provided by what we do, and we're hoping to be able to work and make it easier for the other jurisdictions once they get started on that. Last week we met as a work group and were able to kind of rough draft some legislative recommendations that we'll be making to the executive committee for the next session. And we're putting together our information from that, hoping to get some get those ready to correct any typos that we may have and get those submitted to the legislative committee so that you all can get those onto the next step. And I think that's all I have. If anybody has any questions.
Thank you, Judge Vanover. Any questions for him and the DNA work group? All right, thanks. Now, Justice Lambert and Judge Thompson, I don't know if you people are baseball fans like I am, but in baseball, if you go 1 for 3, you bat 333. That's Hall of Fame worthy right there. I have one of my 3 work group leaders here today. Stacy Tapke and Judge Brown were not able to be with us today, and they send their regrets. But instead of you having me read you their reports, you all are literate adults, so you can read the reports that their groups have filed. They have both met twice in the last quarter. They're doing good work, but I won't take up any more of your time. So go Cardinals. All right.
Now we have the Treatment and Access Committee report from Judge Kevin Mullins of the 47th Judicial District.
Thank you. Personally, I've been doing a lot of work with our Senate Bill 90 program, which is our behavioral health conditional dismissal pilot program. And with that long title, you'll see why we always refer to it as Senate Bill 90. We've had a lot of interest in Senate Bill 90. I presented at the RX Summit in April in Atlanta. In May, we were asked to do that presentation at the Rise 24 conference in Anaheim. And last week, Representative Moser was gracious enough to invite Van Ingram, myself, and Shauna Mitchell to speak at Tuesday's interim joint committee meeting on health services at the Capitol Annex. During our presentation on Tuesday, I think we will probably obviously go over Senate Bill 90. We'll go over House Bill 353, which was Representative Moser's legislation from last year, which decriminalized the fentanyl test strips. We will obviously go over Senate Bill 133, which was an old one back in 2018 that's been modified only to be made better, which is the Women's with Dignity Act, and one of my favorite pieces of legislation to date because it authorizes a judge who has an incarcerated female who is pregnant, who is reasonably to have a substance use disorder, that the judge can actually order that person to treatment if he believes it would benefit that person and the child until the birth of the child or 30 days post-birth. So that's a wonderful piece of legislation we're going to touch on. And we're obviously also going to touch on House Bill 385, which is cess law. Van Ingram and myself are very pleased that Van gets to go first and I get to go second. And we're pleased because Shauna is third. And we both know that if we miss anything, that it's guaranteed that Shauna's going to catch it and bring it up. And with that, I would also be remiss if I didn't take the opportunity to brag and thank Shauna and her staff for, in plain words, always going the extra mile for each of us and the commission as a whole. So the first work group on our agenda is a work group that I've always been very enthusiastic about, very excited about, but also always realized that they had a lot of challenges, because there wasn't as many models or comparables out there. They're creating a lot of this as they go, which is very admirable. And that first work group is led by Crystal Adams, and it's the Intellectual and Developmental Disabilities Work Group. In our last full committee meeting, Crystal gave us an update of their plans and ideas and activities. And after she got through speaking, I had to apologize because during her whole speech, I sat there like a bobblehead doll. And I was just so in agreement with everything that she said. I mean, her ideas, their plans were just all wonderful. And I'm always very candid. And I told her, and I told the members of the committee, after listening to what she told us, and I'll let her tell you this for herself, that it kind of reminded me of the old phrase that I heard, and I think it goes, some attribute it to John F. Kennedy. You know, success has many mothers and fathers, and failure is an orphan. In my honest opinion, I think at the end of the day, that this commission is going to have a number of very proud mothers and fathers who can say we had some part in the work that the IDD work group did. So with that, I'll let Crystal tell us what's going on.
To that. So we have met twice since our last meeting. We were privileged to have Officer Chris Denham from Elizabethtown come and speak to us about the Light My Way program. We were very excited about what he had to say. We're going to be exploring that more in our next meeting about how that can be implemented statewide. The purpose of this program is to allow people to voluntarily provide information that first responders can readily access when they come into contact with an individual who has any sort of special needs related to medical conditions, communication, other disabilities. And he said it's been very successful. One of the things that really struck me the most during his presentation was that the implementation was really quite simple. There wasn't a lot of technology requirements involved, a lot of really complicated processes. And so that made me feel optimistic that there was a good opportunity to kind of take this broader and make this just as an option for people to have more information that they choose to provide to first responders, so that when they come into contact with someone, that they have additional information, that they can approach it from that first moment of interaction and be prepared to provide the support and the interventions that are really appropriate, and so that people have a much better and more successful experience. We additionally were able to have Michelle Niehaus speak and provide a wonderful presentation to our group, as well as joining the work group. As some of you all may have noticed in the presentation, that was one of the areas that was mentioned at the town hall meetings. And as Shauna mentioned, that was pushed to our group. Of course, that doesn't just impact people with intellectual and developmental disabilities, but because so many of the individuals in our population also have other types of needs, especially related to maybe related medical conditions, we have tried to look at the broader needs of people with disabilities as a whole and how we can provide education for that through our work group as well. So certainly her work has a lot of emphasis for our population, but it's much broader than that and going to benefit the entire commission as a whole. And we're really excited about that. She has a training that's going to be one of the first two that we are going to have available. They are in their final stages, along with a more general overview of intellectual and developmental disabilities. We hope to have those ready to go very shortly, and we're very excited to be able to have an actual product to push out to people. We have additional trainings under development in a wide variety of areas that we're working to try to get finalized and make those available. The goal that we have is to kind of provide a general foundation of knowledge across several different areas that really impact this population. And then we hope that once people are able to access that, we'll get feedback from them as well to see what they would like to build on and how we can take that to the next level and really expand upon that. This is the part where I'm probably going to get really excited. So one of the things that we've been privileged to take on in our work group, thanks to Justice Lambert, is her passion for having autism in the courts in Kentucky. And it's taken us some time to really be able to assemble the group and really get the initial work group started. But we were able to meet within the last month or so. And really, I was so energized and so excited after that meeting because the individuals that we assembled, which are largely individuals who come from our universities and other specialized programs, but also most of them happen to be self-advocates, people who have autism. They were so excited and so pleased that Justice Lambert and the commission had had the thoughtfulness to include them in a meaningful way from the very beginning, instead of just as an afterthought of, here's what we've created, what do you think? So they were so really pleased that this had been an area of focus, but that they had really been meaningfully included. They had so many great ideas. They were really passionate to do this work. One of the things they've done first is to look at what other states have done, particularly Pennsylvania. They've done some analysis of all of the materials and trainings that they've done that we're kind of working through and talking through. They've identified a couple of very priority areas that they wanted to get working on right away. So they're currently working on some outlines to submit to the commission for review on a couple of different trainings. One is for individuals who have autism, who may be experiencing the justice system, on the basic information that they need to know and how to navigate that, because we felt like that was really one of the most key areas that was lacking. And then the second was just a general overview of autism to provide that foundational information. Then we're going to develop our own timeline, which is what we're working on now, of what do we want? What do we think Kentucky needs based on what we've seen other states do, and just based on what we feel is really what needs to be done, and how can we prioritize that? We're looking at all different types of methods of training, recordings, live, bench cards. We want to make sure that we really look at all the opportunities available, and we really are optimistic that what we're going to be able to produce here is something that is completely unique. Some other states have, like I said, done some work, but I don't think any of those states have had it be autistic-led. And I think that's really going to make us stand out, and other states are going to be copying what we do. And we have actually already had the Autism Justice Center reach out to us and ask for information about what we're doing. So I'm really excited about that. Like I said, the group is really passionate. They were very grateful to be included, and they were just really grateful to Justice Lambert for spearheading this and getting it started. And that's all for me.
Does anyone have any questions of Crystal about what she just spoke about, or any other questions?
I have a comment. And thank you for the fabulous work that you all are doing. And I think it's an example of where, if any of you have an area that you want to further explore, give it to this commission, because you have wonderful people like Crystal and all the people that she has gathered to work on something. And you can really be a change agent for our issues in mental health. So whatever ideas that you have, share them with Crystal or any of the other folks here, Shauna, Jennifer, and they'll steer you in the right direction. We have over 500 people working on these subcommittees, so it's a very powerful force.
And just for the record, I caught myself bobbleheading again when you got so enthusiastic about the autism, but really Dr. Slusher can't make any fun of me anymore, because I think what was worse might have been Shauna or Justice Lambert. I think they kind of got into it as well. All right. So thank you for that excellent report. And am I correct that the autism training module might be the first module that's approved by the commission?
But this, the overview of autism will be the first one for that autism work group to be finished. And they are starting to work on it closely. So I hope this won't be a long delay. So we'll have the first product for that particular initiative part of the work group.
So the IDD overview will be the very first training module from the commission. Is that correct?
It's the first KJCMH training series. The first one that will be released will be from the IDD work group.
Okay, that's
And
wonderful.
maybe the second one too.
That is wonderful and worth mentioning. All right. The next work group, which is listed on the agenda, is the court responses work group. And as all of us know, it's led by the Honorable Stephanie Burke, who is a tireless champion for 202A reform and very passionate about her AOT program. As some of the other judges have said, unfortunately, I think when their work group meets, it kind of coincides with my busiest docket, so I've not been able to be present on many, but I would love to hear what Judge Burke has planned and what the work group has been doing.
All right, so the court responses work group, I will say, is actually a really good group to work with. It's made up of a really diverse group of individuals who are all very invested in everyone's common goal in this room. And so it's been really interesting since the beginning of this year, particularly during session, when our group has been very much focused on seeing the advancement of our AOT program and mental health courts. And we were seriously concerned when the funding for those programs were cut in the original budget, which came out of the House. And so members of our committee were truly in action to see that that funding was restored. I can say that many of us went way beyond our normal scope of business and duties and responsibilities to ensure that that funding was restored, and ultimately the funding for AOT was restored at a much higher level than the original ask by the governor. So the funding that was granted was, or that was originally asked for, was $4.4 million. They ultimately allotted $5.5 million for to sustain and expand the AOT program across the state, in addition to funding at the amount requested by AOC for expansion of mental health courts. I think that is a really big statement to show that this commission and all of those in this room and on the committees that you all sit in, that we're being heard and that we're getting attention for the work that we're doing, both in the courtroom and in the communities. And I'm really proud of the members of this work group and the things that they're doing. One of the things that we have made a priority is looking closely at the civil commitment statute, particularly with respect to potential changes in the upcoming legislative session. And our focus has been on investigating and studying civil commitment statutes from other states. We've worked closely with the Treatment Advocacy Center, who are the experts in this field, to analyze other states' legislation and determine how we can best craft or modify our definition of danger, particularly as it pertains to individuals who have a well-documented history of serious mental illness and who are currently in a state of psychiatric deterioration. I thought it was really interesting as I was sitting here reading Shauna's or the town hall report, and one of the 5 most common themes was involuntary commitment of adults. And I believe that the issues that we are addressing in trying to modify the statute will address that concern, particularly with respect to barriers to admission, length of stay concerns, and clearly outlining discharge criteria. I think some of the biggest concerns that we hear and that we see frustration-wise, both in the courts, in our correctional facilities, from law enforcement, across the board, is we send people, we find someone incompetent, we send them to the hospital that before we even get off work that day, we see them on the street corner on the way home. They're not held, but we know what we just read. And so we obviously, that is frustrating in my position. And I know that in many of your positions, you have those same frustrations. We had a presentation from the Treatment Advocacy Center at our last meeting. Lisa Daly, who was the executive director, gave a presentation on the implementation of language, which included psychiatric deterioration, gave a really nice breakdown for members of the committee who were not quite as or aware of that or schooled in that. So I thought that was something I wanted to provide for those members who may not know what we were all talking about when that was part of our discussion. We have had outside meetings, myself and members of the committee at different times to discuss the language. In some of the meetings, it has also come up that we would like to address the definition of the word benefit in the statute, because it appears that oftentimes we believe that medical providers are only gauging benefit as medication compliance. And we know that there are other benefits by being in the hospital, other benefits to being in the hospital, not just solely medication compliance. Because we know that sometimes medication compliance doesn't mean anything because medication doesn't necessarily work for everyone. So looking at benefit and with respect to safety and time to get stabilization, I totally agreed with your comment about being surprised that housing was not mentioned more. But these are issues that we want to address in our committee, and we do want to present an amendment in a bill with respect to amending 202A to be more forward-thinking so that we can better serve the individuals, these seriously mentally ill adults who are coming before us in the court. So I think that we're going to have something nice.
Any questions of Judge Berg? Our final work group is the Strengthening Community Response Work Group, and it is led by Wes Butler. I have to say that I've heard countless praise for Wes and his assistance on House Bill 385, SES law, on providing the input and feedback from the hospitals and the hospital associations. So I know his work in that was clearly noticed because I've heard it multiple times. So with that, I'll turn it over. I see Wes, who's appearing online on the top right corner of the screen here. I'll let Wes tell us what his work group is doing and what they have in mind.
Great. Thank you, Judge Mullins, and good afternoon. My apologies that I couldn't be there with you today. In light of our time, I'll hit the highlights, but I'm happy to elaborate on anything if anyone has any questions. Our work group is similar to some of the others that I've heard, is a diverse group of stakeholders and mainly composed of healthcare providers and resource providers. So we've got typically a diversity of viewpoints and ideas. So we often invite speakers to come in from an educational perspective to help create a better sense of a network, help level set on education. And we've had 3 meetings since our last commission meeting. The first meeting was with Dr. Anna Marie South from the UK College of Medicine. She spoke specifically on medication for opioid use disorder and integrating that into the primary care system. It was a fascinating discussion, primarily on the standard of care with MOUD. As many of you know, I think it's fair to say that there's been some discussion or debate within the healthcare community about whether MOUD represents a standard. There still can be a bit of a stigma with MOUD. And there was a clear perspective in the debate from Dr. South in addressing how MOUD really should be considered the standard of care for that implementation. We then had a presentation by Molly Lewis of the Kentucky Primary Care Association. She represents primary care healthcare providers, including federally qualified health centers, FQHCs. These are grantees by the federal government who their primary purpose is to provide access. And she spoke quite a bit on the data with the disparities in access to care and what the FQHCs are doing to meet those needs, and gave some reference to more recent proposals at the federal level, providing grant opportunities for reentry individuals and FQHCs to provide care and access for those individuals. So it was a fascinating discussion. And then finally, we borrowed from Judge Tackett's work group and asked Carolyn Hanshew from the Kentucky Injury Prevention and Research Center to come and talk about Find Help Now. And that was a wonderful presentation just to get us level set on that. Our focus as a work group for the next couple of meetings is going to be on legislative recommendations and priorities. A survey was sent out to our work group members. We have, depending on the month, between 20 and 30 routinely show up for our work group. So hopefully we'll have some feedback from that survey coming back soon so that we'll have a better idea of the discussion within our work group on recommendations for the legislative. So with that, I'll close my report and I'm happy to take any questions.
Any questions of Wes? Any questions of any of our work groups or just, I know we're running a little bit late, but I just want to comment to follow up on what Judge Tackett had spoken about earlier. I think one of the clear benefits of this commission is our ability to make connections and with those connections to ultimately help people. We were eating lunch today and I was with some people and we made some really quick connections with the clerk of Nelson County, who's only been there 55 years. And was speaking to her, talking about how wonderful the mental health first aid training we had. And a few minutes later came by Courtney Maynard with Operation Unite. So it was really nice to be able to make that connection. It was also nice to have lunch with Amy Luttrell, who's the CEO of Goodwill Industries, and just to thank her for all the recovery capital that they're providing statewide to have that opportunity. So this commission has multiple blessings. So with that, I'll turn it back over to Justice Lambert.
Thank you, Judge Mullins. And I hope that you all have been excited to hear from our lead folks here today and from the work groups. I know I have been excited about it. And I want each of you to have this burning fear of missing out of this work and jump in. And I know that most everyone in the room is involved in a committee or a subgroup, a work group of some type. Be afraid to miss one of those meetings because exciting things are happening and will continue to happen. And I'm just amazed at the work that's being done and excited about the work being done. Kentucky will lead and certainly can lead the nation in our collaboration and what follows from that collaboration and open communication. So thank you all so much for being here, both in person and on Zoom. There is not a problem at all with attending any of these meetings that you need to attend by Zoom. Don't miss it. I have that fear of missing out. I know I have that. So thank you. Be safe going home. And we will see you back September 12th here at AOC. And hopefully the lunch will be as good as it was today. It was wonderful. So I am sorry that the Zoom folks missed out on the lunch. It was amazing. So see you back September 12th. In the meantime, attend those meetings and work together. Thank you.
Thank you.